If you have testicular pain, I want you to know that depending on the type and the cause of your pain, physical therapy may be a valid option in helping you to treat that pain. So, just in case you're wondering how physical therapy can help, don't worry, we're going to talk about it. But first, I want to let you know how physical therapy cannot help, because that's important to know as well. If you're noticing that you're having a sudden onset of pain, and you also notice that one side of the testes is sitting higher than the other, so you're looking at the scrotum and one side is higher or even twisted, physical therapy can't necessarily help that. If you're having increased swelling, a lot of redness, and then you're noticing changes as well, like with blood, I want you to same thing know that physical therapy is not going to be your first option. If any of those situations are the case for you, I want you to contact your medical provider immediately, just so that way they can rule out some different things and see if emergent medical care is something that you need, or see if we're able to proceed with other options such as conservative-based treatment to treat your testicular pain. So, if you've been dealing with testicular pain for a long period of time, you don't have to suffer anymore, because physical therapy can help with those symptoms. Physical therapy can help by improving the mobility in surrounding areas. Now, you may be wondering, what in the world can physical therapy do mobility-wise to help with pain at the testes? And the key to know is that when you're looking at the testicle region, you have more than just the testes there, of course. Yes, we know we have the shaft of the penis, but consider more of as far as what's around it. In that pelvic area, you also have lots of muscles that are within the pelvic girdle itself. And then the hips, you have muscles there as well that connect to the pelvic girdle. Consider the back and abdominal muscles as well, because those have close proximity to the testicular region. You also have blood vessels and nerves that help to supply this area. So those are various different things that can oftentimes contribute to pain, and we have to make sure that we're addressing those. And just to give you an idea, I'm going to show you on the little model. I've taken out most of the pieces. Hopefully the kidney doesn't fall out, but I'm going to show you here on this model. So if you're looking within the abdominal cavity, you can see we have the blood vessels that are traveling down on each side, supplying the genital region, so coming down for the shaft of the penis, and then also supplying the testicle region through here, so at the scrotum within the sac. Now, looking through there, I want you to take note as to all like the brownish pinkish tissue that you have here, because those are muscles. Do you see how many muscles within the abdominal region are actually connecting or pretty close down towards that genital region where the testes are? So you want to take into account the muscular impact that can occur. At times, men can have pelvic floor dysfunction, such as tightness, that may actually be contributing to some of the pain and restrictions that they're having with mobility at the testicle and genital region. Some of this pelvic floor tightness can also cause symptoms such as bladder dysfunction, so meaning you can't fully empty your bladder, or even sometimes you're noticing, hey, I feel like when I go afterwards, I'm leaking just a little bit. And that's not always due to a weak pelvic floor. A tight pelvic floor can also contribute to some of those symptoms, and a tight pelvic floor can contribute to testicular pain. Other things to consider are some of the nerves. 3 nerves in particular that readily come to mind whenever I'm treating someone who has testicular pain. I always want to see exactly where their pain is, because if they're having pain in the genital area, it can be several different nerves, such as your pudendal nerve, which is probably one of the more common ones. You also can have your ilioinguinal nerve and your anterior femoral nerve in that area as well, the genital femoral nerve, the genital femoral nerve through that area. Depending on if they're having numbness as well down the front of the thigh, that is more so going to be the lateral femoral cutaneous nerve. So just knowing where those symptoms are, if you're having decreased sensation, numbness, tingling, burning, those different things, we want to check out to see if the nerves are impacted. So what can we do for the nerves? Sometimes we can check out neural tension and looking to see, do we have any increased neural tension? Do we have any restrictions as far as some of the soft tissue, such as the fascia or the muscles that run alongside or with these nerves? Are we noticing any type of restrictions that the nerves are not able to properly slide and glide that can be contributing to lack of mobility, or even caused by the lack of mobility itself? So we're looking at not just the muscles, we're also looking at the nerves. But you heard me mention the nerves and the muscles that are directly related in the pelvic region. What about the nerves and muscles that come off of the back? So be mindful that when you are looking at something that's happening in the pelvic area, we can't just stop there. We have to check and assess to see what your mobility looks like at your hips and at your back, because that can contribute to testicular pain. And sometimes we have limited motion because we just don't spend time stretching enough or doing enough activity, or we spend too much time in one position, such as a seated position, or sometimes we have limited mobility because we are weaker. So, kind of teasing through which option can be contributing to those symptoms can help us better determine how to treat you when it comes to testicular pain. So, men, you don't have to deal with the pain. Make sure that you're speaking up. Make sure that you're getting help. And in the meantime, if you notice that you've been dealing with testicular pain and you're waiting to have for a doctor's appointment, certain things I want you to try are to see, do you feel better when you're laying down? Is your pain less? Do you feel better when you're using compression shorts or some type of compression garment such as a jock strap to help keep things closer to you? If so, then that can be an indication that we want to work on desensitization, also working on lymphatics and blood flow through the area, and still working on the principles of mobility to help you with your pain by addressing the back, hip, pelvic floor, all the different areas in that region, addressing those restrictions. So testicular pain is something that may happen, but not something that you have to deal with. And remember, there are types of testicular pain that require emergent care. So if you forgot what those are, go back to the beginning and review. But here's a little quick snippet. Make sure that if you're having pain that suddenly just occurs without any explanation, talk with someone. Make sure you seek out medical care. If you notice that one side of the scrotum is sitting higher, if the scrotum is swollen, if it's red, if you're noticing swelling down within the penis, make sure you speak with someone immediately just so we can check to make sure that everything is okay. And if not, they'll address your medical need first. And if everything checks out fine on the medical side, but you're still having pain and imaging's not showing anything, you should really consider physical therapy, because I just went through a lot of different ways that we're able to help you decrease your pain and restore your function.